Hello, I will be presenting paper on the role of ultrasound and computed tomography in evaluation of abdominal wall masses, mass-like lesions, and diffuse processes with histopathology correlation. Abdominal wall lesions form a heterogeneous group ranging from benign, like lipoma, cyst, endometriosis, and desmoid tumor, to malignant sarcomas and metastasis. Clinical evaluation alone is often inadequate to define lesion origin, extent, or nature due to overlapping features. Ultrasonography is the first-line modality. It is real-time, radiation-free, and ideal for superficial and vascular assessment. Computed tomography offers cross-sectional detail, better for deep, complex, or infiltrative lesions, revealing calcifications, necrosis, or enhancement patterns. Histopathology remains the gold standard for definitive diagnosis and treatment planning. A combined USG, CT, and HP approach provides high diagnostic accuracy, enables timely management, and minimizes diagnostic uncertainty. Aim is to evaluate the diagnostic performance of ultrasound and CT in characterizing abdominal wall masses and correlate imaging findings with histopathology. Objectives being describe common abdominal wall lesions and their imaging features, compare USG and CT findings, and correlate imaging with histopathology for diagnostic accuracy. This is a prospective observational study. 31 patients with abdominal wall masses were included with Mindray Rizuna I9 USG machine and Siemens Somatum 16 slices CT machine. All patients with abdominal wall swellings are included except for ventral or incisional hernias, patients who are contraindicated to CT contrast, pregnant or lactating patients, recurrent or residual lesions. Sample size is 31. Coming to imaging features of common abdominal wall lesions, first being lipoma. Here is a well-defined oval hyperechoic subcutaneous lesion on ultrasonography with no internal vascularity. On CT, it shows a homogeneous, non-enhancing, fat-attenuating mass consistent with benign lipoma. Coming to scar endometriosis, it presents as heterogeneous irregular hypoechoic lesion at a prior scar site with minimal internal vascularity. On CT, it demonstrates an enhancing soft tissue mass that may infiltrate the rectus sheath. Here, a well-defined, small, well-circumscribed hyperechoic umbilical nodule with hypoechoic rim and mild vascularity in USG. CT shows a superficial soft tissue density without deep extension or aggressive features, being umbilical granuloma. Coming to epidermal inclusion cyst is a well-defined oval avascular hypoechoic lesion with characteristic echogenic debris or keratin echoes. CT shows a smooth, low attenuation subcutaneous nodule with thin capsule, usually non-enhancing. Imaging features of cold abscess being ultrasonography shows ill-defined hypoechoic collection with internal debris and peripheral rim, typically avascular. CT shows hypodense fluid collection with rim enhancement, often tracking along facial planes. Hematoma USG may show heterogeneous or anechoic collection that varies by stage, may show fluid debris levels. CT shows hyperdense lesion in acute phase, becoming iso to hypodense lesion over time, no internal enhancement. Desmoid tumor USG features may show an oval, homogeneously hypoechoic vascular solid lesion in rectus abdominis muscle. CT shows soft tissue density lesion with variable enhancement, often infiltrating surrounding planes without fat attenuation. Liposarcoma USG may show large heterogeneous mass with mixed echogenicity and poorly defined margins, sometimes containing echogenic fat components. On CT, large infiltrative lesion with fat plus soft tissue deposit, areas of septations or enhancement typical of liposarcoma. Here, irregular hypoechoic infiltrative lesion with internal vascularity, often involving subcutaneous and muscular lesion. CT may show enhancing soft tissue mass with indistinct margins infiltrating adjacent planes, suggestive of metastatic deposit. Coming to demographics of the result, mean age of uh, presentation is 43.7 plus or minus 10 years, majority between 42 to 52 years. Female predominance is noted. Middle age group forms the bulk of the study population. 42 to 52 years age group is the most common, and second one being 31 to 41 years. As you can see, female predominance was noted. Coming to results, lipoma was the most commonly encountered abdominal mass lesion in this study. USG is useful for superficial avascular fatty lesions. Scar endometriosis being the second most common, and third umbilical granuloma. And follows after are cold abscess, epidermal inclusion cyst, hematoma, desmoid tumor, liposarcoma. Similar distribution were noted on CT. CT further adds details on depth, enhancement, and plane involvement. Subcutaneous plane is the most commonly encountered plane in this study, muscular being the second most common. Majority of the lesions being benign were avascular, uh, majority, and most benign lesions are avascular. Neoplastic inflammatory lesions show vascularity. Histopathologically correlation also shows the similar data as USG and CT did. Lipoma is being most common with 45% of presentation, endometriosis being second most, abscess, cyst, granuloma, hematoma following after endometriosis. USG CT HP agreement more than 90%. Few discordant cases like liposarcoma mimicking lipoma were noted. USG is excellent for superficial, fat, and cystic lesions. CT is better for deep or complex ones. Lipomas are most frequent benign lesions, predominantly involving subcutaneous spleen. Vascular solid lesions, scar, endometriosis, desmoid require further CT evaluation. High USG CT HP correlation supports combined imaging approach. Lipoma being the most common abdominal wall mass, USG is the first line for superficial lesions. CT to add depth and further characterization for malignancy assessment. Histopathology remains the gold standard, essential for confirmation. Combined USG and CT approach shows high diagnostic accuracy and better management. These are my references. Thank you.